Hi, this is Brian Kim. I'm going to share with you case number 146 in the best way to do cataract surgery series. This is a 3 plus dense lens and a giant sized pupil, and it's going to help me illustrate the nuances of the double chop and cross chop technique. And I'm going to have this done in slow motion so I can go over in more detail exactly what I'm doing so that you can successfully execute the double chop and cross chop technique. So this is the patient's eye. You can see how big this pupil is. I'm using a cotton tip to steady the eye and use a corneal marker, which will help me to center and size the rhexis. This is my paracentesis incision, first on the right side and then the left side, making sure the blade is parallel to the iris plane, which creates a nice corneal shelf, which will allow me to achieve a self-sealing incision. This is intracameral lidocaine, and then some intracameral epinephrine. And this is some dispersive viscoelastic to coat the corneal endothelium and flatten the anterior capsule. Again, you can see how huge this pupil is. Really nice anatomy to be able to explain the double chop and cross chop. This is the triplanar corneal incision. I make a vertical groove, place the blade into the deep part of the groove, tunnel, and then enter. These are the blunt tip Haldane-Parker forceps. These are not the sharp tip ones that I'm using now. This is an older case. Go ahead and puncture the capsule. And then I'm grabbing the right side of the tear, going around circumferentially, grabbing and re-grabbing, making sure that my rhexis is going to match the corneal mark that I made previously with regards to size and centration. You can see this patient has quite a bit of movement of the eye. That's because this patient has heavy breathing and there's wide excursions of the eye with each breath. This is the Capsulorhexis hydrodissection technique. I place a cannula under the rhexis edge contra-incisionally, point the tip down, get a nice wave, decompress on the left side, pointing the tip of the cannula on the right side, hooking the peripheral lens, and the lens begins to spin. Irrigating the surface of the eye, lifting the incision with a chopper, going in with irrigation off to minimize Descemet's trauma, removing the surface epinuclear material. And here we go. This is 0.2x speed. I'm removing the surface epinuclear material. And by removing the epinucleus, you can go underneath the epinucleus, which makes sure that you're definitely within the bag. So I'm turning my hand so that the chopper is going out peripherally, sliding under the rhexis edge, rotating my hand so the chopper is more vertical now. You can see it's not just vertical, but I'm hugging it a little bit from underneath. So there's some posterior support as well. You can see the chopper tip is actually towards the center. I turned the phaco tip vertically, sub-incisionally, and I'm bringing both instruments together. Again, this is a diagonal vector force. The chopper is underneath, posterior as well as peripheral, but then the phaco tip is on top. It's stabbing into the peripheral lens from on top. Both instruments are brought to the center. You can see I'm using the chopper to continue separation of the two heminuclei. I placed the phaco tip between the lens pieces now. So now the phaco tip is deep in that horizontal plane within the lens material. I placed the chopper around the right heminucleus, going underneath the rhexis edge first, turning the chopper vertically, pulling it centrally towards the phaco tip, and then when it encounters the phaco tip, the right heminucleus fractures because it is encountering the phaco tip, which fractures the lens. Again, almost like analogous to the chopper being a knife and the phaco tip is like a cutting board. And so now we have three separate pieces. I use a little bit of vacuum to lift that first quadrant up out of the bag. And as it comes up, you can see it was very nice separation, clean separation of the lens piece. I go ahead and crush the lens piece between the instruments and then emulsify the lens pieces. So again, this is a good example of a 3+ dense lens, and there was a very clear demarcation of a fracturing plane performing the double chop, again with diagonal vector forces. Placing the chopper underneath the second quadrant, pulling it centrally toward the phaco tip, again, fracturing the lens. Again, the chopper is like a knife and the phaco tip is like a cutting board, and you're just fracturing the lens between the instruments, crushing the lens into smaller pieces and then emulsifying the lens piece. Now there's a second heminucleus, turning it in front of me, placing the chopper underneath the rhexis edge, pulling it towards the phaco tip, which is deep in the bag, fracturing the lens, performing another cross-chop maneuver around the third quadrant, fracturing the lens once again, crushing the lens pieces into smaller and smaller pieces, and then emulsifying the lens piece with high vacuum and pulses of ultrasonic energy. So I like to use a little bit of vacuum to position the piece on the tip, and then using the chopper to get around the lens piece, sandwiching the lens piece between the instruments, and then emulsifying the lens pieces. So you saw I turned that fourth quadrant a little bit towards me, fracturing the lens by sandwiching the lens between the two instruments, crushing it into smaller pieces, and then emulsifying the lens piece. You can see this was a 3+ dense lens, but even so, the CDE is around 2. So by crushing the lens piece into smaller and smaller pieces, I try to make the pieces small enough that I'm able to utilize essentially vacuum to remove the lens pieces. So now what's left is the epinucleus. I'm very careful to remove the epinucleus, pulsing the foot pedal to make sure that the posterior capsule doesn't come up. So I take the chopper out, push BSS in, take the phaco tip out, and I go in with the INA handpiece. I always start subincisionally, removing the cortex from anterior to posterior. By doing it this way, you give your best chance of having a clean removal of the cortex. But sometimes it's not possible, and so you have to go after it with some polish mode. So I go to polish mode and try to remove some of that wispy cortical material. You see I'm polishing the posterior capsule as well, polishing underneath the rhexis edge of the cortex and lens epithelial cells. Go ahead and fill the capsular bag with some cohesive viscoelastic, and then I'm going to polish the underside of the anterior capsule with the capsule sweep, first on the left side and then the right side. I'm going to widen the incision because this is a denser lens. With dense lenses, I am also concerned about weaker zonules. So I go in with bevel down, turn the bevel to the left, deliver the leading haptic into the capsular bag. As the optic comes out, I rotate my hand counterclockwise 90 degrees. Use the Maltzman to push on the optic haptic junction and dial the trailing haptic into the bag. Go in with irrigation off, activate irrigation, go underneath the lens, removing the viscoelastic from within the bag. Pushing the optic back down, switching to polish mode, polishing underneath the rhexis edge. Switching to visco mode, removing all the viscoelastic from the anterior chamber, and then I'll hydrate my incision. So again, this is the 3+ dense lens, giant size pupil, and you saw double chop and cross chop mechanical fracturing techniques. Again, you're going out to the equator underneath the epinucleus. You can slide it out, rotate the hand so that the chopper is facing up and down. You can actually rotate your hand even more so that the chopper tip is facing towards you. So it's essentially hugging the lens and supporting it from underneath. You turn the phaco tip vertically, subincisionally, you're going to stab the peripheral lens. And by doing it that way, you're able to have opposing forces on either side of the lens. You bring the instruments together and it fractures the lens in half. You can use a chopper to continue the separation in the subincisional area. And then once you have complete separation, you can place the chopper around the right heminucleus, pull it centrally toward the phaco tip. Of course, the phaco tip is now deep between the lens heminuclei. and then when you pull it towards the center, it fractures that lens piece as well. So you have 3 pieces immediately within seconds, again, not utilizing any ultrasonic energy or vacuum in the process, and then using mechanical fracturing forces to break the lens pieces up into smaller pieces, thereby utilizing less ultrasonic energy, resulting in clear corneas even as early as postoperative day 1. So I hope this was helpful to you, and I thank you for your attention.